My name is Jamie Dudiaak. I am the Community Health Program Associate here at the Farmington Valley Health District, formerly an intern. I got my bachelor's at UConn in social work in 2021, my master's in social work at UConn in 2023, and I'm getting my master's in public health this year at UConn. So when I was graduating with my bachelor's in social work, I knew I wanted to get my master's in social work, but I also wanted something to supplement that and gain a broader experience. So looking at the programs that the dual degree program offers, I thought that public health would be a really good fit because of how synergistic the two programs are, public health and social work. So just that sort of alignment really intrigued me. So in last summer, I was emailed by one of the program staff about this opportunity to intern at a local health department and with all the benefits that came from that. And I immediately answered. I said I wanted to be part of it. I wanted to broaden my experience in public health, just get as much knowledge as I possibly could, and it went from there. So my role was really to take in everything I possibly could here at the Farmington Valley Health District. I worked with the environmental health team doing their inspections and aiding them. So I went out on pool inspections, septic inspections, restaurant inspections, and a lead investigation. And I also did a lot of work with the community health side of the Farmington Valley Health District. I helped develop their community health improvement plan and helped anywhere I really could. I also worked with the Connecticut Association Directors of Health, making some materials for their legislative breakfast this past February. I would say one challenge I had was time. It what a local health department does, it takes way more than 10 hours a week to really get everything you can out of it. So having that 10 hours a week, it just wasn't enough. And so I overcame that challenge by getting hired by the Farmington Valley Health District. Every day I'm here, I learn several new things about what a local health department does. And it's going to take several years for me to get a whole robust understanding of what we do because each day I learn something new about our responsibilities and our community.
My name is Jennifer Curtanis, and I'm the Director of Health for the Farmington Valley Health District. So, we've had a long-standing relationship with UConn to sponsor interns at different times, but being able to provide a stipend for these students, I think, has really made a big difference in our ability to recruit high-quality MPH candidates to work in local public health. Without some of those stipends, we're competing with other public health industries that may be able to provide paid internships. And so this has really allowed us to recruit qualified candidates. So I think it's incredibly important for students to get practice-based learning experience. And so regardless of whether you're an undergraduate student or a master's level candidate, being able to get into the field to apply the lessons that you've learned in the classroom to practical applications in a local health department or other public health agency is really critical to your ability to move beyond your degree and into the workforce.
So the funding from this grant really started my career journey as I got hired here. So interning here, I really had the opportunity to have the time to do so because I was getting that tuition reimbursement and the stipend. Without it, I would have had to work a part-time job, and I don't believe I would have had the time to have an internship here. So it's been a really great opportunity.